Once we had that diagnosis of or we knew the mutation, I was started on Tagrisso in February of 2020. At that point, I would have rechecks every 3 months, CT scan. I was also found to have a metastases in my brain, so I was having brain MRIs every 3 months. At that point, that was just my standard of care for over 3.5 years. At first, the Tagrisso continued to shrink the tumors. The brain one was completely gone. But after about 3.5 years, we started noticing that just a few in the lungs were no longer stable, but now maybe increasing in size. We watched them for 6 months before deciding to do another comprehensive biomarker test. After 3.5 years on Tagrisso, we started to see this slight increase in slide in just a few of the tumors. And after watching that for about 6 months, they decided to do another lung biopsy to see if either I had just developed a resistance or if in fact there was a new mutation. So once again, I had the lung biopsy. They sent it off. This time I did have to wait 10 days. And it was found that I still had that original mutation. However, there was a few other added to the list. The second time I went through the lung biopsy and comprehensive biomarker testing, the results came back as actually having 5 mutations. The first one we knew was the EGFR exon 19. That still was the predominant one. The second one that they found was an FGFR1 amplification, and that one was more well known. The other 3 are less known, but they are the FGF3, the NSD3 amplification, and an FNF703 amplification. So upon reading the results of that test, it was very confusing to me. Again, I had not heard of any of the other ones except the one I currently knew I was treating. So it was a little bit of worrisome, confusing time. We weren't quite sure where we were going to go with all of those mutations. And so it wasn't until meeting with my doctor and a second opinion down at the U that we decided that the ones we would focus on were the 2 main ones. Once we knew the results of that second comprehensive biomarker test, several treatment options were offered. The one that was decided that would have the most benefit was amivantamab. It would be every 2-week infusion and would be followed pretty closely. I started this in September 13th of 2023. The first dose is given over 2 days, and that was a very rough 2 days, just getting my body used to it. And then each week after that for a month, I had more infusions. After that first month, they call it cycle 2, where I now go every 2 weeks. My body is definitely getting used to the treatment. There are definitely side effects, more so than the Tagrisso. But as I go on, we are discovering that it is actually working. So 2 weeks ago, I had my first CT scan in 8 months that actually showed, instead of growing, I am stable. So the side effects of the amivantamab are worth that test result.